Welcome to Physician Focus. I'm Dr. Bruce Karlin. Viral hepatitis is one of several diseases affecting the liver, one of the largest organs in the human body that aids in many critical functions of the body, such as blood clotting, resisting infections, and clearing waste from our system. Nearly 4.5 million Americans are living with chronic hepatitis, and most are unaware they are affected. In this edition of Physician Focus, we're going to examine many aspects of the disease, including its causes and symptoms, how it's diagnosed and treated, and what consequences may occur if left untreated. Our special guests for this program are Dr. Albert Crimaldi and Dr. Maggie Ham, both of whom are in the private practice of gastroenterology with Milford Gastroenterology Associates in Milford, Massachusetts, and on the staff of Milford Regional Medical Center. Dr. Crimaldi specializes in gastrointestinal disorders, including hepatic disease or diseases of the liver, and teaches at the University of Massachusetts Medical Center. Dr. Ham has completed fellowships in gastroenterology at the University of Pennsylvania and Beth Israel Deaconess Medical Center. Welcome to you both.
Good evening.
So what is hepatitis? Al, can you give us a definition?
Well, the term hepatitis just simply describes the description of the inflammation of the liver itself. It does not always connotate a viral infection. There are a lot of agents that can cause liver inflammation or hepatitis, including our own immune cells. Our immune system can literally attack our liver, a condition known as autoimmune hepatitis. Toxins, of which there are a variety available to attack our liver, from medications, that is prescription medications, to over-the-counter medications, including acetaminophen, to poisonous mushrooms.
And then the favorite among Americans, I understand, is alcohol.
Oh, another toxin that clearly carries a great deal of significance for long-term liver disease. Even herbal medications can cause this. We have a variety of genetic disorders which have been shown to impact the liver. Problems with iron overload or iron metabolism disorders, a condition known as hemochromatosis, copper metabolism, which is known as Wilson's disease, as well as cystic fibrosis. So you can see there's a variety of diseases, not just viral causes. However, the viral causes are the ones that have really gotten a lot of attention. They are prevalent in the U.S. society, and now we're getting better and better treatments, and it's an exciting time for us who have the opportunity to treat liver diseases.
So let's start by separating all the hepatitis, that's the plural,
that's it,
into acute versus chronic.
Sure.
What are the acute, the quick happenings versus the chronic happenings?
Well, in the case, we'll just use viral hepatitis. Many of them start as an acute infection. The classic is hepatitis A. That virus practically never goes on, in fact, never goes on to chronicity. It's not a chronic infection, it's an acute infection. And in most cases, we clear it, although it can be quite detrimental, it can be fatal. But it's rare to have that happen. Hepatitis A is one that's foodborne or is more of a contagious disease. That is as opposed to the other two common hepatitises, which are hepatitis B and C. Hepatitis B is, again, an acute infection. That means it's an active disease, but it can go on to chronicity. Fortunately, we now have a vaccine, but the chronicity of that infection is much less common than in the case of hepatitis C, where the majority of people who contract hepatitis C actually end up with a chronic illness. And there's the one that has been causing a great deal of health impact. Chronic liver disease, liver cancers, these are all consequences of hepatitis C.
Now, we've dealt with the viral causes. Maggie, I understand your favorite area is one among the non-viral causes. Do you want to help us out with those?
So the more common, it's called non-alcoholic fatty liver disease. And so you can get fatty deposition in the liver from either alcohol or just from obesity.
So fatty deposition just means that your liver gets populated with little fat bubbles that aren't supposed to be there.
Exactly. And then with time, that can actually progress into inflammation, what we call hepatitis, non-alcoholic steatohepatitis, which is NASH.
So the difference is the irritating agent in the viral hepatitis are the viruses themselves and what they're doing. What's going on with NASH?
So with NASH,
non-alcoholic. I'm sorry. Now I'm doing what we refer to as doctor speak. The non-alcoholic fatty liver disease.
right.
What's going on there?
So with fatty liver, you're having increased fat that gets taken up in the liver, and it basically occurs in something we call metabolic syndrome. So anybody who's obese, anybody with a diagnosis of diabetes, especially type 2 diabetes.
And type 2 diabetes is the one that we're seeing the big rise in, because
Exactly.
that's the one where you're not as prone to the immediate troubles with diabetes, but you've got to take care of it or you get the long-term outcomes.
Exactly. So, and then if you have high triglycerides, high cholesterol.
So these are components of the fat that we metabolize.
Exactly. So if you have any of those issues, that puts you at increased risk, and that in time can lead to inflammation in the hepatitis in fatty liver.
So is it because we're overloading ourselves with fat? Because we metabolize fat all the time. I mean, that's something the liver presumably does.
Exactly.
So why doesn't it just take care of it and get rid of it?
Well, we're overloading it, and now with current diets and people with increased rates of obesity in the country, it's becoming more and more prevalent, and it's about to, in a few years, it'll probably overtake viral hepatitis as a common cause of liver transplant also in the U.S. So as hepatitis progresses, as the inflammation progresses, what happens to the liver? Al?
Well, God was very good to us. He gave us a liver that can take a lot of hits. That is, we have probably about 10 times as much as we actually need. But as the inflammatory response to the liver takes place, we generate scars. I often use the analogy that if I had an itch or an area of my skin that was itching all the time and scratched it all the time, eventually it would turn into a scar. Well, anything that's chronically inflaming our liver can cause it to generate scars, and those scars isolate areas of the liver cells such that they don't communicate with other areas. And it is that sort of breakup of the continuity of the liver that results in the condition known as cirrhosis. In fact, if you look at it pathologically, what you see is a lot of nodules. The individual cells, some of which don't look all that bad. However, their inability to work together.
They don't communicate.
Their inability to communicate amongst themselves results in liver dysfunction. That produces our inability to make proteins, our inability to make clotting factors. It can literally slow down the progress of blood coming from the lower extremity and intestine up back towards the heart, where it's going to return and get replenished with oxygen. That backup of those pressures can develop bleeding risks, as well as causing abdominal distension, a condition known as ascites, where you see a protuberant abdomen full of fluid secondary to these high pressures.
So how do I feel that? If I've been dousing my liver with one of these toxins, be it a virus, alcohol, Tylenol, whichever toxin you deal with, how would I know that I've got it? What happens?
You may not necessarily know right away. Some people will present initially with initial infection or whatever it is with jaundice, but occasionally in cirrhosis, for example, with scarring, people don't develop jaundice until much later in the stage. So you may present with just fatigue, shortness of breath from just having fluid buildup in the lungs. You might have swelling in the ankles, and general just not feeling very well.
So then I don't necessarily feel anything. So people with like chronic hepatitis C, as
Right.
Al was talking about, might not even know they've got the disease. So how would I ever find it if it's so symptom-free for so long?
Right.
That's obviously a subject that has recently been in the news because of the prevalence rate of hepatitis C in the country, which is substantial. There are over 3 million people with hepatitis C. But it's interesting that many of those, that more than half, probably don't know they have the disease. And you do have to be tested. And so, you know, there are different ways of going about testing. Some would be to look at those at highest risk. Well, the high-risk factors for hepatitis C are having received a blood transfusion prior to 1992 or a history of intravenous drug use.
What happened in 1992?
Well, we developed better testing, and we were able to discover.
So we actually test our blood supply.
Our blood supply. So now the blood supply, the risk of hepatitis C in transfused blood is extraordinarily low. It is not zero, but it is quite low, and it has essentially dropped off the map in terms of a cause of hepatitis C. So there's just rare cases.
I was just thinking back to 1992 when we used to refer to what's now hepatitis C as non-A, non-B.
That's correct.
We didn't know, and it was
right, and
all the others.
We didn't know too much about the modes of transmission at that time, but we knew that transfusion carried a high risk. And you know, what we've learned from these experiences is the need to limit transfusions when possible. I think new guidelines come out about that all the time, as well as these better modes of testing. But again, risk factors are one method of screening for hepatitis C.
So what other risk factors do we have?
So tattoos are a big one.
And why tattoos?
Just from using dirty needles, not using new needles between patients and infecting one patient after another.
Well, they're not, they're customers. But
I mean, customers, exactly, until they become patients.
Just curiously, I've had patients come in and they always say, well, you know, I always see them put out a clean set of needles. And, you know, I think reputable tattoo parlors do, but yes. I still think, in my heart of hearts, I still think that there's a risk there because the tattoo artists themselves are at such high risk of hep C. Yeah.
Well, it has been documented that there is an increase with risk with tattoos, even when you controlled for issues such as the transfusion risk as well as intravenous drug use. So there is an increased risk. It potentially is in the inks themselves to make sure that it's one user per ink. But there may be other factors that I don't think we totally understand, but clearly are present, and that's what the most recent publications are telling us, that clearly it is a risk. Body piercing is a risk. Again, anything that involves the potential of blood transfer is a risk. Other things are not a risk. Sharing glasses or you know, kissing a person with hepatitis C is not going to transmit that disease. It's blood transmission.
I've got patients, husband got his hep C back in Vietnam, and they've been together for 30 years, no transmission.
Right. Sexual transmission may occur, but the rate is incredibly low. And therefore, the CDC, in one of its initial declarations, did not recommend barrier methods for those involved in a single monogamous relationship. So that, you know, they also concur that the risks are low for other forms of transmission. Again, the big one is IV drug use and the prior transfusion risk and any blood transfers.
So I understand that there's a push on to test everybody Is there, do you see value in this, and testing baby boomers in particular? Or?
Yeah, I think one of the issues with the testing of the baby boomers is actually just a numbers game. It turns out that there are about, you know, 3.5 million people with hepatitis C, but it turns out that 3/4 of them are in that baby boomer generation. That is born between 1945 and 1965. And in fact, if you look at a real subset of that, it's even a higher percentage in that. It's listed at about 3.5% for the generation in general. But between 1950 and 1960, those born in that interval, they're carrying about a 4.3% carriage rate for hepatitis C.
It's pretty high.
It is very high. And in fact, when you look at that and know the health consequences, that hepatitis C can go on to cause cirrhosis and hepatocellular carcinoma, it will make a health impact to identify these people. It will decrease the spread of disease and simultaneously allow us to intervene because we do have treatments that are helpful for us.
Well, let's hit a few of those treatments because that's the big name and the big game in hepatitis C these days.
It is, and treatments have been available for a number of years since the 90s, but we're getting better and better at treatment. The current treatment is a triple drug therapy, which requires interferon, ribavirin, which is a nucleoside analog. It interferes with the replication of the virus, as well as what are called protease inhibitors. And these are for genotype 1. There's a variety of genotypes with hepatitis C, in fact 6, 5 or 6. 6 is the common term. And for genotype 1, the one that's the most common
these are
in
just
the United
strains
States,
of hepatitis C.
They're just different strains of hepatitis C.
They all do the same wonderful things.
In the end, they all do the same. Fortunately, a couple of the types, particularly genotype 2, is very amenable to simply interferon and ribavirin. However, genotype 1, which is the most common in the United States, is a very difficult
tough nut to crack.
It is, and it requires that 3-drug regimen. If you can get through that 3-drug regimen, and that is not an easy task, you can look for a 65 to 75% cure rate, which is remarkable. But the newer therapies could be even better.
And I understand some people, not an insignificant percentage, actually clear the virus on their own.
Yeah, actually it's interesting because about 15 to 20% who get hepatitis C will clear it. And in fact, it's sort of interesting when you look at hepatitis C, where the majority will clear it. Like 80% of them will clear hepatitis B.
Hepatitis B, okay.
And only 20% or 15 to 20% go on to chronic disease. The inverse is true with hepatitis C. About 80% will go on to chronic disease.
Okay, but we've got good treatments, and so it's important to diagnose.
Yes.
And in your yearly physical, if you have liver function tests, you may unearth a bump in some liver enzymes, which might get your doctor to do that, even if you're not in a so-called high-risk group.
Right.
What about NASH?
So
The
with
non-alcoholic steatohepatitis, the fatty liver disease.
It's a little trickier. You may not have any abnormalities in your liver enzyme necessarily, although that's usually how it's picked up. And then you'll have an ultrasound done or some sort of imaging that would show the fat in the liver. But it's not always the case that you'll have abnormal liver enzymes. And so if you've had a long history of diabetes or obesity, this is something that should be looked into, especially because weight loss can make a huge difference with these patients.
So tell me about that. Here it is. You're saying this is, again is a hepatitis, so it's an inflammation of the liver, and this time the inflaming agent is just you ate too much.
Yes.
And so the cure of it is eat less.
Eat less, exercise, and there has been a study in the New England Journal of Medicine that showed vitamin E could be potentially helpful in with inflammation from the fat. Now, it's not, you can't recommend that to everyone. There are concerns about heart failure in certain patients, so it's not for everybody.
But basically, vitamin E, it's not a cure.
It's definitely not. No.
All you're doing is mollifying the
exactly
the thing. And still, if I hear you correctly, you're saying that the main thing, eat less.
Eat less, exercise
Lose
more.
some weight.
Some weight, exactly. And that's important because you want to prevent the scarring, because scarring can lead to cancer, and you may need a liver transplant. So that's
So wait a sec. The steps are scarring, cirrhosis, and cancer at the end of that?
So potentially cancer. Not everyone develops it, but we do screen for it every 6 months if you do have known scarring.
Okay, so cirrhosis, of course, in Greek means, or Latin, one of those languages, means scarring.
Yes.
Means scar. So if you've got cirrhosis, then one of the natural endpoints is if you've inflamed the liver enough and you develop these liver cancers.
Yes.
And that gets you a quick or a quicker liver transplant?
Possibly.
Or not.
Or not, depending, on the size of the lesions, how many there are, and you're never guaranteed. And there's always a weight limit on surgeries too. So if you're too big to get transplanted, then that's it.
Okay.
Yeah.
So, but what other treatments are on the horizon for NASH? Anything? We always on the primary care side, we're always looking for things like. They say some of the diabetic drugs work a little bit, and the diets work a little bit. Is there anything on the horizon here for?
Nothing groundbreaking, and they have compared it to some diabetes drugs, but they also have side effects. Weight gain is a big one also, which is something you want to avoid in these patients, and it hasn't been shown to be more effective than vitamin E anyway. So really, there's nothing big other than just trying to lose some weight, diet, and exercise.
But again, it's important for us to recognize these things and then start managing the
Absolutely.
overall disease.
Yes, definitely.
So, what should we be doing for prevention of hepatitis of all varieties?
Well, it's sort of interesting because taking a lead from what Maggie was saying, we'll just go back to that example of hepatitis C. One of the reasons we want to screen for hepatitis C is not everyone manifests with abnormal liver tests. So you even in the case of a viral hepatitis, such as hepatitis C, you can have normal liver tests and yet have active disease going on. And that's one of the reasons you have to literally screen for those. You have to check to see if they have the antibodies, and if those antibodies are positive, to assess whether or not there is actual RNA, that you're not one of those who...
RNA is a product of the virus that you can test for.
The core of the virus, yes. And in fact, what it determines is an active infection, as opposed to having had an infection, because we've already discussed that about 20% will clear that infection on their own. So it's very important to be able to identify those who are carriers to decrease the spread of hepatitis. Clearly, getting an assessment to find out if there are liver test abnormalities is imperative, because going to your primary care physician, getting those kinds of basic laboratory studies. We take a lot of medications in this country. We take medications to lower our cholesterol to try to prevent some of the ravages of those weight issues, but they can cause an inflammation of the liver, typically not to the extent that one needs to discontinue them, but they are a marker to pay attention to make sure that those liver test abnormalities are coming from that particular medication. Is there an issue of a genetic disorder such as iron overload, which many of us wouldn't have no way of knowing unless identified under testing purposes? So I think there is a lot of things we can do beyond the testing issues, and that is the diet and weight loss and healthy lifestyles would make a big difference. Obviously, the biggest sort of the elephant in every room is alcohol, and because alcohol has carried such a high rate of causing cirrhosis, and leads to other illnesses as well, but cirrhosis is probably the biggest.
it takes a fair amount of time of pounding the alcohol to get the cirrhosis, but it's very much there. And
the liver is amazing in that even with these
it's
viruses,
very forgiving.
It take 20 years for the virus to cause trouble.
We're coming close to the close, so let's just touch on some of the important points for NASH. The things that what would you tell folks to do to be safe, and what things should they avoid? And
so the best thing is just to diet and exercise play a huge role in reducing the risk for developing NASH. And even the recommendation is about 10% of your current body weight. But if you can even lose 5 or 10 pounds, that can make a huge difference as well in terms of reducing the inflammation. So not to discourage anybody, but 5 pounds is a start.
Well, it's a great start. It's very doable.
Yes.
And for the viral hepatitis,
I sort of want to make the pitch that when your primary care physician calls and says your liver tests are a little abnormal and we want to do some further testing, it's not a time to panic.
It's a time to test.
It's a time to test. There are a lot of reasons those things can be abnormal, many of which are self-limited, and one that we should all sort of stand back, take a deep breath, and allow the process to take place, knowing that there are diseases such as hepatitis C, which carry significance. However, we have good treatments, and we're going to do well.
Okay, well, thank you both. You've been marvelous guests, Dr. Al Crimaldi and Dr. Maggie Ham. And that concludes it for another edition of Physician Focus. And for more information about hepatitis, visit the websites listed at the end of our show. And to view past Physician Focus programs covering a variety of healthcare topics, visit our website at www.physicianfocus.org. I'm Dr. Bruce Karlin. Thank you for watching.
I'm Dr. Albert Crimaldi.
I'm Dr. Maggie Ham.
Hepatitis is a disease of the liver, a major cause of cirrhosis and liver cancer, a leading cause of death by infection, claiming some 15,000 lives each year.
Hepatitis is actually a group of 5 unrelated viruses, with one of the most common being hepatitis C. Most patients who contract hepatitis C develop a chronic or long-term infection.
More than 4 million Americans are living with chronic hepatitis, yet most do not know they are infected, putting them at risk for complications and increasing the likelihood of spread of the disease to others.
Some of the highest rates of hepatitis C appear in those born between 1945 to 1965, the so-called baby boom generation, and health officials are urging those people to get tested for the disease.
If you're in this group, call your primary care physician to arrange for testing. The good news is that hepatitis C can be successfully treated with medication.
For more information, visit the U.S. Centers for Disease Control website.
I'm Dr. Nathan McDonald.
I'm Dr. Jeff Hopkins.
For many medical emergencies, time is critical and delay in treatment can lead to more serious consequences.
That's why we encourage you to learn some of the common warning signs and symptoms of medical emergencies that might require a visit to the emergency room.
If you or someone you're with has difficulty breathing, chest pain or pressure, sudden dizziness, difficulty speaking,
uncontrolled bleeding, persistent vomiting or diarrhea, sudden or severe pain, or is coughing or vomiting blood,
go to an emergency department. Specialists are available 24 hours a day, 7 days a week.
Remember, too, that the most important step in preparing for emergencies is to prevent them from happening, so put safety first.
And develop a plan to follow when emergencies do occur. Know your medications, medical conditions, and the name of your primary care physician.
For more information on warning signs and preventive steps for emergency medicine, visit emergencycareforyou.org.